We will discuss which cancers are now diagnosed at younger ages than before and the reasons behind this trend. We will also cover how to protect against these cancers, if possible, and how to diagnose them early to improve prognosis. Generally, cancer is considered early onset if diagnosed before the age of 50. However, we will focus on cancers now commonly diagnosed under 40, which was previously uncommon. Melanoma is a cancer that has notably increased in younger populations. Melanoma is a type of skin cancer that arises from melanocytes, the dark skin cells. Sometimes melanoma arises from existing moles, and sometimes it appears as new growths. The risk of melanoma has significantly increased due to increased sun exposure and tanning bed use. Additionally, growing awareness of skin cancer has led to earlier diagnoses. The risk of melanoma is notably higher in people with fair skin, blonde or red hair, and blue eyes, particularly those with a history of excessive sun exposure and a family history of melanoma. Melanomas resemble moles, nevi, but have distinctive features such as asymmetry, border irregularity, color variation, diameter greater than 6 mm, and evolving shape and size. Although some moles can have these features, they are referred to as atypical nevi. If melanoma is detected at early stages, the prognosis is very promising. However, late-stage detection is associated with a poor prognosis, highlighting the importance of early detection. Melanoma is commonly diagnosed between the ages of 50 to 65, but recently, diagnoses have been occurring at younger ages. A skin biopsy is used to diagnose melanoma. The second important cancer that has increased significantly in individuals stage under 40 is colorectal cancer. The exact cause is unknown, but it is likely correlated with increased consumption of processed meats, such as sausages, hams, and burgers, as well as a sedentary lifestyle, obesity, and smoking. The incidence of colorectal cancer among adults under 50 increased by 63% from 1988 to 2015. A family history of colorectal cancer in first-degree relatives is an important risk factor. Inflammatory bowel diseases, such as ulcerative colitis and Crohn's disease, also increase the risk, as do obesity, a sedentary lifestyle, smoking, and alcohol consumption. The gold standard for diagnosing colorectal cancer is colonoscopy, recommended to start at age 45 and be repeated every 5 to 10 years. For earlier diagnosis, stool tests such as the fecal immunochemical test, FIT, and the guaiac-based fecal occult blood test, GFOBT, are non-invasive tests that detect hidden blood in the stool, which can be an early sign of cancer. These tests are recommended annually. If colorectal cancer is diagnosed early, the prognosis is much more favorable than in later stages. For example, the 5-year survival rate for stage 1 colorectal cancer is around 95%, while it drops to 5 to 10% for stage 4. The third important cancer is breast cancer, with a notable global trend of younger age at diagnosis. BRCA gene mutations are a significant factor in early-onset breast cancer, as well as a strong family history of breast cancer, even without known genetic mutations. Obesity, a high-fat diet, and a low-fruit diet are correlated with an increased risk of breast cancer. Alcohol consumption also elevates the risk. Starting menstruation at an early age increases lifetime exposure to estrogen, thereby increasing breast cancer risk. Women who have never given birth have a higher risk compared to those who have had children, also related to the duration of estrogen exposure. Chemicals like bisphenol A, BPA, are found in plastics and other environmental pollutants may mimic estrogen and contribute to increased breast cancer risk. The gold standard for breast cancer screening is mammography, which uses low-dose X-rays to create images of the breast and can detect tumors that cannot be felt. It is recommended annually or biennially starting at age 40 for average-risk women. Breast MRI is used for high-risk women, e.g., BRCA mutation carriers, strong family history, and is more sensitive than mammography but also has a higher false positive rate. Ultrasound can also be used, but the aforementioned methods are more useful. Women with BRCA1 and BRCA2 mutations have an almost 70 to 80% chance of developing breast cancer before age 80, with BRCA1 being a stronger predictor than BRCA2. These mutations also increase the risk of ovarian cancer, prostate cancer in men, and pancreatic cancer. For individuals with a strong family history of breast cancer, first-degree relative diagnosed at an early age, screening should start from 25 to 30 years old, while for the average person, screening starts at 45. The fourth cancer now diagnosed at an earlier age is thyroid cancer, especially in women. There is no known cause for this earlier diagnosis, but it is thought to be due to improved diagnostic tools and overdiagnosing, such as the overactive removal of benign nodules. The prognosis of thyroid cancer is generally good, especially when diagnosed early. Risk factors for thyroid cancer include iodine deficiency, radiation exposure, and family history, and it is more common in women. CT scans and X-rays, especially during childhood, can increase the risk of developing thyroid cancer later in life. Obesity is also related to thyroid cancer. High-resolution ultrasound is the primary tool for detecting thyroid nodules, and thyroglobulin is used to follow up on thyroid cancer patients. The fifth important cancer is pancreatic cancer. It was usually diagnosed after the age of 60, but recently it has become more common in younger populations. The exact cause is not known, but it is correlated with diabetes, obesity, and an unhealthy diet. Nowadays, around 8% of pancreatic cancer cases are diagnosed before the age of 55. Smoking, genetic predisposition, and alcohol consumption also increase the risk of pancreatic cancer. Genetic predispositions, such as a familial history and genetic mutations, e.g., BRCA2, PALB2, contribute to the risk. There is no standard screening test for pancreatic cancer for the general population. High-risk individuals, e.g., those with genetic predispositions, may undergo endoscopic ultrasound, EUS, or magnetic resonance imaging, MRI. Challenges include that pancreatic cancer is often diagnosed at an advanced stage due to nonspecific symptoms and the lack of effective early screening tools. The earlier the diagnosis, the better the prognosis, but generally, pancreatic cancer is considered aggressive and difficult to manage.